Hi, everybody. Thank you for joining us today and for your participation in Knockout Opioid Abuse Day in New Jersey, where we try to teach people about the risk of prescription opioids and their link to heroin and fentanyl use and overdoses in this state. We have with us today Dr. David Leopold, who is going to speak about the alternatives that exist to treating pain, alternatives to opioids. So we are grateful to have Dr. Leopold here with us today, and we hope you enjoy his presentation and learn a lot about the alternatives to opioids. Thank you so much.
Thank you, Matt, and I want to thank the Partnership for Drug-Free New Jersey for having me here today. This is a topic that I think is really important, and I'm excited to share with you so many options to opioid use that I've used successfully in my medical practice over the last 20 years. I want to start off by just talking a little bit about what exactly is integrative medicine. It is a patient-centered approach which relies on partnership building between the practitioner and the patient. And I think one of the things that is most important and to me extremely valuable is the empowerment that it provides to the patient. And so trying to move out of the physician doing all of the things or doing things to the individual, rather giving the individual skills that they can then utilize to improve their situation, really whatever type of situation we're in. And we treat the whole patient. So not only do we look at what's going on from a medical standpoint, we look at what's going on in terms of their overall physical well-being, their emotional well-being, status of mental health. We look at their social environment, their physical environment, and then the spiritual component and what makes a person tick, so to speak, what gives their life meaning and purpose. And then we try to come up with the best plan we can for the individual. We focus on not only treatment of the disease itself or the condition that we're trying to treat, but also promotion of overall health and ultimately prevention of disease. And the definition that I have settled on is really the optimization of a person's health and well-being, irrespective of whatever medical condition they have. There's really always something that we can do to try to improve a patient's situation. We use evidence-based medicine, and whenever possible, utilize natural, less invasive approaches. We try to harness the innate healing response of the body. I'm trained as a medical acupuncturist for about 20 years now, and so we regularly utilize acupuncture in my approach to patients, and I'll talk a lot about that going on. We also use a lot of mind-body interventions. I'm also trained as a mind-body specialist, and it's something that is incredibly valuable, and we'll talk about that as well. Lifestyle medicine is incredibly important for all of health, but I do find that particularly for patients with chronic pain, we can often significantly improve somebody's just basic health foundation by lifestyle modification. What are you eating? Physical activity, sleep patterns, et cetera, management of stress. And I'm going to talk about that going forward because that's a foundational approach. And then I'm just going to briefly touch on natural supplements. Natural supplements go beyond the scope of this discussion, but there are select natural supplements that I do use in my practice, and I found them to be very effective. However, the caveat I always give is these should always be discussed with your healthcare practitioner. Natural supplements do have the potential to not only cause benefit, but also they can cause problems, and so they need to be used very responsibly. And this approach, when studied, is beneficial, and you can see about a great deal of benefit in about 60% of patients who utilize it. And interestingly, it actually gets even more effective as pain severity increases and when used with conventional approaches. And so this is something that I've done my whole career, is how do we blend the things that I just spoke about with conventional medical approaches and optimize the well-being of the individual. So sometimes it's not possible to eliminate the use of medication, but we can often reduce the use of medication and hence reduce side effects from medication. You can see here that in these studies that when people were using opioids, it generally indicated they had a higher degree of pain severity, but over 80% actually reported a very significant benefit. They also noted improved functionality, and that's something that I think is really important. And if you go back to what I was saying earlier about empowerment of the patient, it's the improved functionality that really is truly the goal. We want to reduce pain as much as possible, but it's not always possible. People who have had severe trauma, severe injuries, or severe disease, sometimes we really can't do much, honestly, to move that pain. However, but what we can do is improve the functionality of the individual. We can give them their life back, so to speak. And this is something that I do regularly, and I'm proud that we can do that, and it improves their overall quality of life. I just want to go over some of my background, not to be, boasting, but mainly because I understand that the things that I'm talking about are non-conventional. And this has been my approach for about 20 years, working with patients with chronic pain. And I'm a board certified physician in family medicine. I'm also board certified in the field of integrative medicine. And while it was in existence, I was board certified in integrative pain management. And like I said, I've been practicing medical acupuncture for about 20 years. I completed a fellowship in integrative pain management at the Scripps Center for Integrative Medicine in La Jolla, California. I also completed a fellowship in integrative medicine at the University of Arizona. And that has led me to my current position as Network Medical Director for Integrative Health and Medicine in Hackensack Meridian Health. I also sit on the pain and opioid management steering committees here at HMH. And I authored two chapters that I'm going to reference here. One was cancer-related pain, and another one was integrative medicine and rheumatology. And the reason I go over this is to let you know that I take pain very seriously, and I take the treatment of pain very seriously. And that's why what we utilize is evidence-based. It's very important to me that the treatments have an acceptable risk to benefit ratio. I don't like when patients are told things are going to benefit them, and in fact, the reality is they're probably not. I'm always very honest with my patients, and it's this background that I think gives me a very good assessment of what can we really do for the individuals that I'm seeing in the clinic, and how much can we really affect the situation. I do think for most patients, we can get significant improvement, as I said, to quality of life, functionality. And so I think that these approaches are very valuable, but I'm also cognizant that sometimes the best option for a patient is an epidural. Sometimes the best option is a surgical intervention. And those are discussions that we have to have. And sometimes they're tough discussions, but nevertheless, they're important. The things that I tend to treat most in my clinic are things along the lines of chronic pain, and that can be from systemic disease. When I was particularly at Scripps, we worked hand in hand with our neurosurgery department, our orthopedic department, rheumatological department, to really help people who had significant trauma, motor vehicle accidents. We saw people from the military. And what we often did was how could we treat these people who were either not surgical candidates or had previously failed a surgery or did not want to have surgery, and realistically, what could we do? I treat a lot of cancer, and I treat a lot of cancer-related pain, and fortunately, there are a lot of things that can be very beneficial. Complex pain disorders, including things like fibromyalgia and regional pain syndromes. And also, I think it's important that we address mental health and psychological pain, because often these things go hand in hand. I show this slide just because I want everybody to understand that these things I'm talking about can be really effective. And this is a small sample of postcards that I have from my patients from all around the world. And one of the things that I find the most rewarding is when I see a patient who tells me they were told that they can't do something, and often it's a big trip that they want to take, or they want to be physically active, they want to get back in their kayak, they want to do the things that they used to do. And so one of the deals I've made with my patients is, if we get you out there, I just ask that you send me a postcard. And this is just a small sample of some of the postcards I've received from patients all around the world, and just some of the things that people have written. And this is not because of anything great that I'm doing. This is really because I believe in the empowerment of the patient and getting the patient back into the world and having them in a situation where they have the courage and the ability to go forward and do these things that they want to do. I can tell you that really very few patients where I have felt confident enough to say you should take that trip have not had a really wonderful time. It doesn't mean that they don't have pain. It doesn't mean that they're not limited. I included this one from one of my patients who said, I was able to walk halfway up the Great Wall of China. So, she couldn't make it the whole way. It was a very steep trip, but she was not even going to go on this trip. And so she was able to go on this trip, have a tremendous time, a tremendous achievement for her to be able to do that kind of activity. And, even though she didn't make it all the way, it was still a once in a lifetime experience for her. Okay, so when we look at what's going on and what are some of the drivers of pain, we have to look at inflammation. And inflammation is a normal physiologic response to injury. But as we all know, over time, if it becomes dysregulated or out of control, it can cause problems. And one of the main things it causes is it causes a lot of chronic disease. Obviously, heart disease, it can contribute to things like cancer, even mental health issues, but certainly it drives pain. And so one of the most important things that I do in my clinic is try to drive down inflammation. And we do this all the time with anti-inflammatories and other types of medications. But you can also significantly reduce inflammatory burden by changing lifestyle. And so things like being sedentary or being highly stressed or sleep deprived, eating a very poor diet, all of these things drive inflammation. They basically perpetuate inflammation and make it worse. Conversely, getting good sleep, eating a healthy diet, being physically active, stress management, these things, and I'll put in there positivity as well. These things all reduce inflammation, and they do it in a very potent way. And often it's very possible to reduce things like anti-inflammatories for patients, because you can take so much of that inflammatory burden away with lifestyle modification. Now, lifestyle modification is not easy in any way. It's very difficult. In fact, I tell my patients all the time, to be healthy in the modern world is actually very difficult. You have to fight against so much that's out there, but it is worth it if you can do that, and hence improve your overall inflammatory burden and improve a lot of other markers of health. So let's look at just sort of our standard American diet here. And, there are hundreds and hundreds of studies out there that clearly show that foods can cause inflammation. And so some of the main offenders are things like saturated fats, particularly saturated fats from animal products, various types of cooking oils, particularly if they're very high in omega-6 fatty acids. A major issue in this country is overconsumption of refined carbohydrates, highly processed foods. These increase the load of sugar into the body very quickly, pushes an inflammatory reaction, and then a rapid drop. Sugar just in and of itself, and trans fats, which are much less common now, but they're still out there. They can still be used in food. I would say excessive alcohol can certainly be a driver of inflammation. And in some patients, I'm not a huge anti-gluten guy, but clearly in some patients, particularly those with autoimmune conditions, gluten will drive inflammation. Now, that's the bad news. On the other side of that is that foods can actually reduce our inflammatory burden. And when you hear about things like the Mediterranean diet, that's the one that's most studied, but really you could take virtually any diet that is mostly plant-based with small amounts of animal products, preferably things like cold water fish are utilized, and small amounts of meat if you feel that that's something you want to incorporate. But when we look at this, there's nothing magic about this. The foods that are contained in the Mediterranean diet have multiple natural substances that naturally reduce inflammation, and they do it along the same pathways that our drugs reduce inflammation. They inhibit things like, well, I won't get into that, but they inhibit the same pathways that our medications use very often. And sometimes they actually do it even better, although when you're using a medication, you're getting a very large dose of something. So it's going to have more of an effect immediately. But over time, this is one of the most effective ways that I help my patients reduce their pain medications, is to significantly decrease their inflammatory burden by dietary modification. We see things like plants, coffee, tea, all of these things with polyphenols. Fiber, most people in this country don't get anywhere near the amount of fiber that they need, and that is a potent anti-inflammatory when utilized. Now we'll move on to being sedentary. And I wrote, sitting is killing us, and it's literal. It's not just a phrase. 50% of US adults don't exercise on a regular basis. And you can see here that multiple studies from all sorts of different fields clearly associate being sedentary with increased morbidity and mortality. In other words, you are going to have more disease and you're more likely to die from any cause. And so when we get people up and moving, it significantly improves their overall health profile. And you can see one of the things that will improve with physical activity is pain. Most chronic disease will improve, and we'll talk about how to get moving in the future. But, amalgamation of all of the studies that are out there clearly show that being physically active, so not being sedentary, not sitting around, but also incorporating exercise. And it's important that anything you do that gets you moving is very, very beneficial. So I don't get hung up on times or duration or intensity for people. The main thing is to get people up. And one of the main things that I think that we do with integrative medicine, and particularly with things like acupuncture, is it creates a window for people to actually re-engage and become physically active again. In other words, even if we can just get you walking around the house, walking around the house leads to walking around the block. Walking around the block leads to going shopping for the first time in years. Going shopping for the first time in years leads to taking those trips that I was talking about. And this is something that happens all the time when people start to get their confidence back and their ability to become empowered and to take control of their health. So being physically active is invaluable in getting people to reduce the needs for pain medication. And you can see here, hundreds of studies now show that really all we need to do is walk. You don't have to be in the gym. You don't have to be lifting tons of weight. You just have to be moving. I want to talk about stress because stress is something that is epidemic in this country. And I think it's one of the things that people don't realize how much stress they're under all the time. My rule of thumb is that if people don't have an active stress management program, then stress is almost certainly adversely affecting their health. In other words, if you're not doing something to offset your regular life, and what people often say is, well, I don't have any more stress than the next person. Well, that's irrelevant because the next person is almost certainly extremely stressed. So just because it's normal doesn't mean it's okay. And this manifests in our physiology. It's not just that our brains feel stressed, it's that our physiology is stressed. We are constantly in fight or flight. And if you go through that physiology, that means we're constantly in a state of increased inflammation. So another way to decrease inflammation is to get your stress under control. And there are multiple ways to do that that are extremely effective. And I'll talk about those. But you can see some of the things, how stress can manifest. And it can manifest as pain. I'm sure a lot of people out there know when they're stressed, their pain gets worse. And fatigue. Fatigue's a big one. I see patients all the time who come to my clinic because they're fatigued and all of their labs are normal. Nobody can identify why they're fatigued. They're fatigued because they're chronically stressed, and that's driving a lot of health issues for them. They're stressed psychologically and physiologically. So there's a lot that we can do to help to manage stress. And I won't go into this, but basically the main concept here is that Our brains are hardwired to hold on to stress and to danger because that's a survival mechanism. So we have to work very hard to offset that. So when a stimulus comes in, anything, somebody cuts you off in traffic, somebody's not nice to you, we have the capacity to respond really in two ways. We can either get angry, get sad, do nothing, crawl into a fetal position, or we can do something that's productive. And you can train yourself to do the things that are more productive. And we do this all the time. Almost anybody can do this. I probably have 5 patients a year that we really can't work with. We use biofeedback techniques. We use lots of different interventions. But mind-body interventions basically increase the duration between a stimulus and a response so that the immediate brain reaction is not one of fight or flight. We're talking only about microseconds, but it's enough time for our higher brain functions to come on and say, what do I really want to do here? What is really the productive thing that I want that's going to make this situation better? And it's extremely effective, and we can teach it to almost everyone. And when I talk about mind-body interventions, I often people sometimes roll their eyes at me. And I think we really need to dispel the concept that we're talking about some person with a long beard and long hair sitting on a cliff somewhere meditating into the wind. You can do that, but meditation is utilized by some of the most successful people of our day, and they'll all talk about it. I always cite Tom Brady, who regularly cites meditation as one of the main reasons for his success and longevity in the field of academics. I included here the chairman of Ford Motor Company. I think the guy with his knees crossed is the chairman of Twitter. All sorts of athletes. Oprah, if Oprah does it, it's got to be great for you, right? So mind-body interventions are purely based in science. Basically, when you do mind-body interventions, you're essentially telling your brain it's time to relax. It's the opposite of fight or flight. It's what we call the parasympathetic nervous system. And you're activating that relaxation response, forcing your body into a state of relaxation. It's basically foolproof. It's why you see, and it's basically centers around things like breathing. It's why you always see athletes take a breath before they're getting ready to do something big. They may not know that that's what they're doing, but that's what they're doing. And you can see here multiple studies from big journals, the NIH, showing clearly that mind-body interventions work and that there's a lot of evidence for them to be effective. And so particularly for things like low back pain, non-specific low back pain, we know that back pain is extremely difficult to treat. In fact, mind-body interventions are some of the most effective interventions you can utilize at the 1-year mark for low back pain. So it doesn't mean we take all your medications away for a year. It means that we're working up to this to reduce and hopefully eliminate some of these medications. I want to touch on acupuncture now. Acupuncture is a very valid medical intervention. Like I said, I've been using it for almost 20 years. When I lecture to my colleagues all the time, I tell them all the time, if you take away all of the history of acupuncture and all of the Eastern components of it, what you have is a medical procedure that works. And in fact, it would be taught in medical school all the time because it's that effective if we could get rid of some of the things that surround it. And I don't mean that in a negative way, because I think a lot of those things are really valid. I'm just saying if we look at it purely from a scientific standpoint, in and of itself, it is an extremely effective intervention for pain. And I use it with virtually every patient I have that has pain, because while it is most studied in things like chronic back pain, chronic headache, chronic neck pain, cancer pain, it's really applicable for virtually all pain situations, at least as a trial. Doesn't mean it's going to work for everyone, but we should at least try it. And you can see here, all of these major organizations endorse the use of acupuncture because it is so effective. And I'm just going to go over some of the data that really made people say, okay, we really have to pay attention to this because it works. I can tell you that I've been utilizing or supervising acupuncture for 20 years. I've supervised literally thousands of procedures. I've done thousands of procedures. I don't do as many anymore because I have an excellent team that in fact does it a lot better than I do. And I'm still surprised at how effective acupuncture can be for so many conditions. I'm still surprised as a physician wow, that really helped that person. I almost didn't think that was going to, really work, or this person has a really bad condition. So acupuncture is really almost always worth a try. And you can see here multiple studies, including the fact that acupuncture is effective for a really long time. So if we get your chronic pain under control, most people for up to 12 months after they are done being treated are still going to be in an improved state than they were before. That is incredible, that you could do something, stop it, and then people are still better. Acupuncture can be effective for conditions that often require surgery. You can see here at the bottom, tremendous amount of people who are scheduled for back surgery actually end up not needing back surgery if they have acupuncture. Not everybody. And what I do in my clinic is I take a real look. Let's look at your MRI. Let's look at what's going on. Let's look at your symptoms and see, is this reasonable, or ultimately, are you probably going to have surgery? And we have to have those honest conversations. But very often, particularly the combination of acupuncture, physical therapy, and mind-body interventions is incredibly effective for reducing the need for people to have surgery in my clinical experience. And you can see here a lot of direct evidence that it helps reduce the use of opioids. Acupuncture is utilized widely by the United States military. The Veterans Administration uses it regularly. They not only do they use it for things like PTSD, but they use it for pain. Why do they use it? Because they needed something that was effective, that was low cost, that had low risk, and would work quickly. And what did they find when they used acupuncture? Decreased use of opioids, almost 50%, decreased muscle relaxers, decreased non-steroidal anti-inflammatories, decreased benzodiazepines. And the soldiers reported improved symptoms, improved sense of well-being, and improved ability to function. This is a valid medical intervention, and it should be utilized really much more than it is. And so I would encourage you, if you have not tried this, to at least explore it. There's a special type of acupuncture called battlefield acupuncture, which was pioneered again in the military, which utilizes special points on the ear. And it was actually developed to be used in the battlefield, and they found it was quite effective at reducing pain. I think this is a really important slide. This is from the American Journal of Emergency Medicine, so it's not from a lightweight journal. This is acupuncture versus morphine in the emergency department. And you can see here, patients with acute pain, again, this is not for every single condition, but this is for conditions where the physician thought it was appropriate to try something other than IV morphine. So acupuncture versus morphine was better at reducing pain, it worked faster, and it was better tolerated than IV morphine. And morphine is pretty strong. It's a great drug, but certainly we would agree that if we could minimize the use, particularly in the emergency department, that would be really beneficial. So I just want to quickly, in the couple of minutes that I have here left, go over some things that you can do. This is just our quick start guide on how to eat healthier, because what we've learned is it's not enough just to have the information. But basically, you can start off by just making half your plate plants. Try to get at least 5 to 10 fruits and vegetables in per day. Reduce sugar as much as you can. Use whole foods. Try to reduce your processed foods. And we go for about an 80 or 85 to 20 or 15. Make 80 to 85% of your meals really healthy. Then have a great time with the other stuff, and just enjoy yourself. We think that food should be enjoyable. Here are just some very simple food exchanges that you can utilize. So one of the things, if you can get off soda, tremendous benefit. Our soda is so detrimental to our physiology for so many different reasons. But if you can switch to some of the flavored carbonated waters, you don't have to give up chocolate. Just switch over to higher quality, high levels of cacao, lower levels of sugar. Ice cream can be replaced with Greek yogurt and fruits. So the list goes on. French fries or fried potatoes are very detrimental to the body. Try switching for things like carrot sticks or celery sticks and hummus, and for candy, dried fruit. This is not, I get it. Sometimes you just want these things. I accept that. But in general, day to day, if you can start to make some of these shifts, I think you'll see some real benefit. Staying active, the best thing I can tell you about staying active is a lot of people say, man, I hate exercising. Okay, that's fine. but you have to get over that, because we are meant to be active as human beings. Being sedentary is extremely detrimental to your health. It's going to worsen your pain. Most people, even if they don't like exercising per se, love the results. They love how they feel when they're done. Find something you enjoy. Find something to incorporate into your day-to-day. Think about things that you enjoyed as a kid and start exploring those again. And one thing that can be really beneficial is working on an exercise prescription with your physician. The more specific you can get about what you're going to do for physical activity, the more likely it is you're actually going to do it. So you have to be specific about what you're going to do. When are you going to do it? How long are you going to do it? Where are you going to do it? So I have my patients actually write out, I'm going to go for a walk at 9 a.m. around Booker Park, and I'm going to do it for 25 minutes. And when you do that, it really, really makes it so it's much more likely that you're going to do it. Meditative breathing, we don't really have time to go over this, but anyone can meditate. We teach people to meditate all the time. We teach people how to utilize mindfulness-based stress reduction all the time. This is something that even if you've tried it and you were thinking about 100 different things, that's normal. If you've never trained your mind to enter into a state of relaxation or calmness, of course, the first 20, 30 times you do it, that's mostly what's going to happen. But over time, just like going to the gym, over time, you get stronger, you get more cardiovascular reserve. Over time, your mind will calm down. It's like a jar of muddy water. And if you sit it on a bookshelf, when you come back to it a couple of days later, a lot of that stuff has settled to the bottom. You come back to it a month later, even more has settled to the bottom. And now you've got some clear water at the top. So anybody can learn how to meditate, no matter what your past experience is. Sleeping well, I think it's just important that we prioritize sleep. We do not prioritize sleep in this country. When people are sleep deprived, pain increases, fatigue increases, myofascial pain increases. We just do not function well. So even if it's just for 2 weeks, try to prioritize your sleep, get at least 7 to 8 hours a night, and see how you feel, and write it down and note what happens to your overall well-being, because I would venture that you're going to feel much better. Selected natural supplements, I don't really have time to get into this, other than there is a lot of evidence that some of these things really do work. They have to be used judiciously. They have to be used very carefully, and particularly if you're using them with other medications. You need to find a practitioner skilled in the use of natural medicines to help you make the right choices, because the other thing is, you don't want to waste your money. There's so much out there that is so expensive that is not going to do anything for you. You want to choose supplements that are actually have a reasonable chance that they're going to do something. When I choose supplements for my patients, it's because I think there is a very good chance that this is actually going to help them. I don't use things that don't have evidence for efficacy. That's just wasting time. It's wasting money. It's causing false hope. And it's just not, it's not helping anyone except the people who make those supplements get more money. But there are plenty of things that actually do work, and I do use these regularly in my practice. Okay, so just in summation, there's a lot that we can do. I think it's really important that we optimize our lifestyle, and you have to work on the things that I just was talking about. Again, it's not easy. Doing these things is difficult. It requires constant output to live a healthy lifestyle in the modern world. It's important to work with your healthcare practitioner. You have to agree upon a plan going forward. How are we going to move to a state of using less medication? If that's your goal, I really, in my practice, I have not had too many patients who really, really wanted to reduce the use of medication that we were not able to either reduce the medication or significantly improve their functionality, even if we had to hold the medication steady. And again, there are some conditions where we're just stuck with the medication. But if you can improve quality of life, functionality, that makes a tremendous difference. And with that, I'm going to conclude. Where there's hope in the future, there's power in the present. That's my 84-year-old mom ziplining. She was diagnosed with terminal cancer 16, 17 years ago, and she's still going strong and cancer-free. And, you know, it just goes to reinforce that when someone is empowered, they can really make tremendous strides, irrespective of what we think is going to happen. So everyone's an individual. When people have the capacity to take stock of their own health and to work with a practitioner, really the potential is limitless. And with that, I'm going to conclude. Thank you. I know I went significantly over my time, and I do thank all of you for sticking with me. I've put our phone number there, and I'm happy to take any questions that anyone has, and I'll do my best to answer those. Thank you very much again.